At the Royal Marsden, we're involved in a bone trial with Philips and 3 other centres internationally, and the purpose of this is to treat painful bone metastases in patients who have failed other standard options.
So the partnership from Philips with the Institute for Cancer Research and the Royal Marsden Hospital is a good example how we at Philips strive to improve people's lives, make the world healthier with innovation. And we can develop all the innovations, but it needs to have such partnerships to really understand the needs and the desires of our customers and what the patients need, and then eventually bring them to the patient's bedside and to the benefit of the patient.
High-intensity focused ultrasound is an enormously powerful technique. It allows us to destroy tissue at depth within the body without damaging the surrounding tissues or the tissues that overlie it. Using such a technique and being able to deliver it very precisely means that we can look into a number of different treatment techniques, and we can investigate them preclinically and clinically.
So far, all of our patients have experienced a reduction in their pain. Some have been more than others, but I think it has been meaningful for all of them. They're patients who maybe have been used to being in pain for quite some time and weren't feeling very optimistic that anything was ever going to get on top of it. So even the quite small reductions in pain have really kind of had quite a positive impact on them, and just little things that they've been able to do that they weren't able to do before, like go for a walk their dog, do up your own bra, that kind of thing. Just having to be less reliant on others to do just normal, small, everyday things.
They've all reduced the amount of analgesia they're taking. A reduction in analgesia is no mean feat, really, because the analgesics make you feel rather dopey and out of touch during the day, so just being able to take less opiates, for example, is a huge advantage.
We've been doing focused ultrasound surgery, high-intensity focused ultrasound research at the Institute of Cancer Research for some time now. But it wasn't until the partnership between Philips and the Focused Ultrasound Foundation came along that we have been able to get a clinical system into the hospital, which will allow us then to treat patients.
The partnership here is important at 3 levels. On a clinical level, we want to understand how HIFU, high-intensity focused ultrasound, can be used in the clinic with the patients, and therefore we have this first indication running the clinical trial for painful bone metastasis, but we want to understand further indications. On a more fundamental level, we want to understand the interaction of focused ultrasound with bony structures that will help us in treatment planning, understanding, and further treatment delivery. And last but not least, we have agreed on a teaching program, training program for clinical and technical people to disseminate the technology, the knowledge of this technology, into other institutions.
Like any new treatment, you always start with patients usually who are end stage and have failed other treatment opportunities. So this is why we've started with the painful bone metastases. But I think the next stage of MR-guided HIFU would be to treat recurrent tumours in order to prolong life. And that will be a much bigger step. After that, it will be a question of using MR-guided HIFU as an adjuvant therapy, so that we're combining it with other standard therapies and seeing where its place is in the entire armamentarium of cancer therapy. And then finally, we could perhaps use it as a primary therapy in some cancers.